name is Charles Turner. I'm the CEO of CARE. That's CARE with a K. We founded the company back early 2019. Kind of went live end of October 2019. Started it because a bunch of us in the industry, in the senior care and the post-acute care industry, knew there was a significant labor problem already with us, and we knew it was looming. As people are getting older and there are fewer people in the workforce, we knew that we had to have a different labor solution that currently was out there. So a bunch of us in the industry got together to start CARE, and then of course COVID hit, and then we've been riding the crazy waves of that up and down for the past couple of years, but it's been a net positive for us. Well, my background, so I'm an owner and operator. You know, we're not a bunch of kids in a garage, so we know what being on the front lines of a building is like, and what the financial impact of having poor staffing or not enough staff, or bringing in staffing agencies or having to pay overtime. I mean, the first thing I do as an owner of buildings, every month I get my P&L, the very first thing I do is I look at how much overtime is the facility spending. That tells you half of what you need to know about what's going on in an operation. If we could create a solution that really cuts that down and makes it easier to hire and easier to cut cost, it's a win-win for everybody. And so it was a kind of a no-brainer solution rolling into building CARE. Yeah, so I'll tell you, pre-COVID, we were expecting by the year 2030 to be expecting about 2.1, a worker shortage, about 2.1 million people. Since COVID, we do a lot of research because we have tens of thousands of people that work on our platform. We have a great research base, and no one else really has this because we have, everybody wants to talk to what is a facility doing, but we can actually talk to frontline workers. Our research tells us that probably around 15% of the current labor force has permanently left the industry. So now we went from, call it 2.1 million people that we got to solve for 2030 to about 2.8 million people we have to solve. Because CARE is a labor marketplace, meaning that people come and they can throw money into the marketplace. It's actually a way to bring people in the industry. We do know this, that we're actually bringing people into our industry to work because they've never considered senior care, or they work in schools and the schools are shut down for COVID. So we actually know we're solving a lot of the labor crises because we're actually creating a market. And as any economist would say, the solution to high prices is high prices. You start bidding up labor enough people are going to want to come into it, and those prices then start to come down. So we're actually, in certain markets, in certain cities in the US, we're already seeing that effect. There's a reason why they go work for one facility versus another facility. Pay is obviously the big one. The other big one is literally comes down to respect. And one of the things we know in hiring any frontline caregivers in senior housing, but frankly kind of any frontline worker, is the idea of culture. Like what you and I think of company culture is that's not how they think. Their version of culture is very, very tactical. It's how do I interact, in our case, how do they interact with that resident? And do you respect me enough to want to work for that resident? And if you don't give me that respect for wanting to provide care, then I'm going to leave and go someplace else because I know there are 1,000 buildings that'll pay me just as much, if not more, than what you're paying me. Now, the reason why people want to work at CARE on our platform is most of our people actually have a full-time job someplace. So these aren't people that work for staffing agencies and this is what they do. They're using us to make extra income. So our average hero on our platform works maybe a shift and a half to a week. So it's not like they're doing this as a full-time job. It's a way to make extra income. And the beautiful thing about it is that the two things that we provide that a typical traditional employer doesn't is that we provide, as long as you get a 4 or 5 star rating on your shift, you get paid the next business day. And also you can work when and where you want. We don't require where you work or how much you work. You can sign up with us, never work at all. We want you to work, but it's the ultimate flexibility. The traditional employer hasn't wrapped their head around that quite yet. So that's what makes us pretty successful. I think in May 2019, I was literally thinking, okay, Golden Section has done a really good job selling me on what they think they can execute on. Can they really do it? Turns out they did, which was great. But it was also, how do we, it's a weird thing. When you know the market really, really well, you know the customer base really well, you know the problem you're trying to solve really well, you know what you're doing is going to solve the problem. The question is, until you get it out there, Will it? Will people adopt it, right? Because when our industry, it's a very a slow-moving industry in terms of innovation, and so everything checks all the boxes. Like there's no logical reason this shouldn't work, but you're not dealing with logic sometimes. You deal with emotion, and you're dealing with, hey, we've done something the same way for 50 years, right? So for us, it was like, okay, this sounds great in theory. Is it really going to work? And then, lo and behold, October hits when we first launched. It was supposed to be just 2 buildings, just as a test market. It ended up being 17 buildings, and then it just took off from there. We still had a lot of the, well, let me think about it. I got to talk to this, talk to that. But we had enough early adopters. It was the classic sort of, I guess crossing the chasm of, you got a lot of early adopters, but then there was that group that was slower to adopt and slower. But then of course COVID hit, people need staff, and everyone's just like, if you have people that just please work. And then, they love us because we're happy to help and we can help, and we've given sleep back to that frontline administrator. We were already going to partner with a handful of companies, right? What companies can operate multiple buildings, and they said, hey, go pitch this to such and such local building, and they come after you with every reason why they shouldn't do it, because it's a new concept. Right? I mean, intellectually they like it, like, well, have you thought about this regulation? This, like, look, we're from the business. We know the regs. We know what we can and can't do, and then you finally get them over that hump. There's one regional vice president with a large nursing home company, nationwide nursing home company, that she was like very reluctant. You could tell her body language says, her mind was saying yes, but her body was clearly saying no. And we said, look, there's no financial commitment. You don't have to sign it. It's a pay-as-you-go model. So finally, once she kind of got blessing from corporate, she did it, and then she had immediate success. And now, if you look on our marketing material, she's all over our marketing material. She's one of our biggest proponents. She's the staunchest defender of what CARE does, because she was stressed out. She was having stress, and we solved that stress for her, and the easiest, the most elegant way possible for her. And so she's like, there's nothing else out here like this. And now she's a big fan of what we do. Our big fear in March 2020 was everybody was, so if you think about back at that time, right? We didn't have universal PPE. Policies and procedures, infection control procedures that were still being like, what do we do? And the accusation was these, like, say, staffing agency nurses were going building to building, spreading it. And there's probably some truth to that. So for about 45 days, like March and April of 2020, we got a lot of, we can't have outside workers coming in. Well, a couple of things happened during that time. One, we got with you guys. We're like, okay, let's slam some features in real fast to alleviate that stress and document how we're alleviating that, right? Which was a major, major godsend for us, because we all, again, knew what we had to do from a regulatory standpoint and a process standpoint to make our customers happier. But then at the same point in time, as they were saying no outside labor, well, 15% of their workforce is like, well, because COVID thing's freaking us out, we're out of here. So after about 45 days, like, the world just pivoted. And they said, well, not only went from we can't have outside labor, it's like we have to have outside labor. And I'll never forget this. You and I, we were together in Colorado. And Bridget was, my co-founder, Bridget Kaslag, right, was with us. And she and I were working at a table doing stuff, and we were sitting there, it's like late June, and we were watching the number of shifts getting posted go boop, 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 boop. It doesn't actually make a sound, right? But it was like boop, 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 boop. Like, we're like, what is going on? And you could tell everybody at the same point in time went from like, we don't know, to boom, right? And so that was like our first big COVID. At Black Lake. And we knew that was our first big COVID inflection point. We've had these like major waves, and that was our very first one, which we thought we were like so cool, like how many shifts we were filling, a day at that time. And of course we just like dwarf that. But at the time I was like, oh my God, this is amazing, And so it's crazy to watch when people realize how simple it is to sign up with you and get people working, and then just loving the elegance of the platform you built to help them out. So if you think about your traditional staffing agency, it's usually you have someone who sits in a cubicle somewhere with a spreadsheet of people that are on their roster, right? And if I am a nursing home administrator, I say, oh gosh, I need somebody. So I call Betty at my contract and staffing agency. I was like, Betty, I got to have someone like tomorrow from 2 to 10. And so Betty works her spreadsheet, calling, can you work? Meanwhile, I'm the administrator and I don't know if she's getting a hold of anybody. One, I don't know if she's getting a hold of anybody, if I'm going to have somebody. And two, I don't know if that person's going to be any good because that person works for the staffing agency. So with us, we just eliminate all that stuff. So the community says, hey, I need someone from tomorrow from 2 to 10, like click, boom, it's out there. They know if someone wants to come, and they see, if let's say I'm a hero, you're a hero, I'm a 4.2 star, you're a 4.9 star. Well, I'm going to choose Dougal. I get to see every review you've ever had. So I'm going to choose who I want. So we always say, our heroes don't work for us. We're just the middleman. They work for that community for that 8-hour shift, and they're highly incentivized to do a good job. So for us, for the hero, we provide that next day pay. They get a 4 or 5 star rating and they do a good job. Well, they're going to get paid the next day. Otherwise, they have to wait a week or so to get paid. And so it's good for the hero because that not only do they get the next day pay, but they get the ultimate flexibility and they get that immediate feedback of how good they're doing. And so they'll want to do a better job and improve their skill set and improve their interpersonal skills so they can continue to get paid and compensated the next day. Yeah, it's funny, you gave me the book, The Hard Thing About Hard Things, and early on in the book, I was reminded, one of the best lines from that book was talking about when you're running a startup, even if you have hypergrowth like we do, the quote was, when you're running a startup like that, you have only 2 emotions, like complete abject terror or euphoria. There is no in between, and both can be accentuated due to lack of sleep. I'm like that. I've never read anything that describes me more than that. There's been a lot of sleep and things like that. So, going back a year or so, I mean, honestly, the same fears I had a year ago, or a lot of the same ones I have now, it's how do we grow the team? We can hire people, that's not a problem. It's hiring the right people on our team, the right leaders for our team that fit the culture. One of the things the reason we've been able to grow, our product is elegant, it's great, but it's hiring the right people that are well connected and well respected, which is hard to do. One of the things people always say, our customers will always say about us, and I hope they always will, is they just love the people that work at Care, right? And that's not me, that's everybody else that's on the team. And I hope that's always the case. So finding that next person or next group of people is a hard. We spend a lot of time. So, I go every 6 months, I have these kind of freak out moments like, oh my gosh, we're really, really behind in our hiring. We really need to bring the right people in. That's what keeps me up at night, thinking about, cash burn. I won't go through the pedantic nature of how we pay and then collect, but there's a lot of stress with that, and making sure, juggling, wanting to drive EBITDA, but not wanting to drive too much EBITDA because then we have tax implications, and it's there's this constant balancing act where I'm always thinking about. But then the things that are keeping me up now. So last year was how do we get it so our process is our process and people are scalable. And I think we've done a pretty good job in most areas on that. We're still always going from 2 people to 4 people to 10 people is one thing, but then going from 10 to 40 is another, going from 40 to 100 is another. The layer of complexity in an organization, that's where we are now. So we have 100-ish employees. Your organizational development is, that's key. Last year, outside of going to conferences that opened up in the fall, we spent $0 in marketing. We didn't need to. But now 2022 is all about building brand dominance. And so what do we need to do from a marketing standpoint, and what do we need to do from a process and scalability standpoint? Those are the 2 things. So, it's brand dominance and process and scalability. So those are the things that keep me up at night. I think some of the I don't say that some of the financial fears are not there. I mean, we're profitable, but I think we're kind of hitting this point where, okay, it's giving us choices where we can really now throw fuel in the fire and grow. Yeah, it's funny. So, obviously you know this, right? We have an operations center in Guadalajara. We have, I think we have probably around 80 employees now. So I looked at on the calendar, it was January of 2020, had been the last time I had been in Guadalajara until like May of this past year. So almost a year and a half went by. And when I left, we had just hired employee number 3 and 4 in Guadalajara. I just had hired. And then by the time I came back, we were up to 40. It's like, how did that happen? And the cool thing was, outside, the entire time I think we lost 2 people. Like one had to move to the States, and another one was an engineer that frankly just didn't work out. But everyone else stuck around and wanted to be a part of it, and still wants to be a part of it. A lot of it is we were pretty early on, and now we're pretty rigorous in our hiring practices, meaning that we're looking for people that have like a really high EQ. Yeah, we want them to be sharp and we want them to be hustlers, but we want them at super high EQ. And that does a couple of things for us, right? One, they're on the phone a lot, talking to folks, and they're dealing with people that have emotional needs, right? There are a lot of frontline workers that may not have the best interpersonal skills. Like, how do you show empathy for that? They need to have empathy for that. But then in doing that, you have a lot of like energetic, high EQ folks that really help build that and drive that culture locally. So the time we came back, we were still obviously communicate with folks on a daily basis to grow that culture. And we're on Slack relentlessly. We're on Zoom relentlessly. And so, we were virtual before it was cool. So we already had that even our US leaders are all over the US, right? And we're in the Houston office, but we have people all over the US. So we had to be virtual from day one. So we kind of had already gotten it down and how to build that culture. And, it's an old adage, right? Communication's everything. And we try to make sure we communicate as well as we possibly can and hire the right people. I'm a big fan. I hate to use sports analogies, but I'm going to. I don't draft for skill. I try to draft the best athlete and plug them in where we can. I think generally speaking, that's been a winning strategy for us because we just hire people that fit on the team, and then they figure out a role for themselves. Yeah, that's such an interesting question. I mean, to be frank with you, it's. Personally speaking, I had to make the commitment back in 2019 that for this to be successful, I had to be all in, which meant, for a time, they were early on, right before we launched, I'll never forget this, like August of 19 through really, definitely through Thanksgiving and almost through Christmas. Bridget and I'd be like, we wake up at 6 o'clock in the morning, we roll over, get in our computer, and we work. And then, we work until 2 o'clock in the morning when you go back to bed. It was relentless. But we knew we didn't have a choice, right? And so there was a lot of sacrifice on personal time, personal relationships, and personal interests, notwithstanding the fact that CARE was it's also a big passion project for us as well. So, but what it made us do is it made us focus on those things that we really. The last 3 years of this journey had forced me to focus on those things and be very intentional around those things that I do find joy in, and kind of removing those things from my life that I do just because I did. Oddly enough, one of the things that helped with that was COVID. Like, you're sort of thinking you didn't do much anymore for a while, and so it's like, what, I don't feel I need to go back and do that right now. But it has been, my family's been behind me 100%, but it's been a lot of, they know like this has been a definite grind. And I've probably missed some things, right? So it's one of those things where, if you think you're having work-life balance and starting doing a high-growth tech startup, you're not gonna, or it's not gonna go well, right? That's one of the things I see in a lot of startups. People want to say, okay, I'm gonna keep my full-time job and do this on the side, maybe hire somebody. I'm like, I've never seen that successful. You're either in or you're not, right? And you got to be willing to make that sacrifice. I'll tell you. So last month we took about half our team to Cabo, right? So we had this thing like if you were employed by December 1st of last year, and we hit a certain goal, then you qualify to go to Cabo. And everyone early on, people thought I was joking. It's like, hey, we had an earlier goal, like it would have been like 30 people would have qualified, like had you been employed by August the 1st. And they said, if you hit this goal, you're going to Cabo. And I was like, no, we're going to go to Cabo. And I called them on it. And like, really? Yeah. So sure enough, they hit it, right? And then I extended it to everybody up through December 1st. So we took about 45 folks or so to Cabo. And I think one of the most cathartic moments of my life was, Bridget and I had seen Bridget, right? So Bridget had been on maternity leave for several months, and with COVID, we were traveling. I physically had been in presence for a long, long time. And knowing what she and I were doing in the end of April, or end of 2019, we're just grinding and doing everything ourselves. So now we have 100 employees, and 45, half of them or whatever are with us. And everyone's having, like, from the second we picked them up on the bus, the second we dropped, we left, it was on. And I don't mean bad, it was a celebration, right? It was a celebration of everything we had done. And she and I we kept looking up at each other across the room, like, how did this happen, right? How did this happen? And just watching all these folks that, just have a blast. And that was probably one of the most proudest moments of my life. Not for my own sake, just for like, the fact that we could do this for these folks, right? It was great. It is the grind. I mean, it is the constant. You never turn it off. I mean, that's also kind of part of my personality. I'm not a big believer in work-life balance. I don't get people like, okay, I shut down at 5 o'clock and I'll pick it back up at tomorrow at 9 or whatever. My mind is kind of on. So, but knowing that's my personality, but doing that times 10, and knowing some of the sacrifices you have to make to get to this point, to make it successful and not want to let your team down, right? And I know there's a lot riding on my shoulders, and a lot of us know there's a lot of the leaders know a lot. The company's only successful if we're successful and everyone does their job. So not wanting to let everybody down, investors, employees down. That has been it's a constant weight, and you have to kind of get used to that at some point. So, but at the same point in time, it's been really cool watching us to go from nothing to where we are, and also knowing we're still only hitting the tip of the iceberg, right? We still have a ton of ways to go. So, long way to go. I will call Gold Section out because especially early on, there's certain things I knew. I knew the product market fit. I knew the product we needed to develop, but it was the how as well as helping. As a founder or something like this, your mind's going a million miles a minute, and you need someone to come along to help you structure how's the best way to do this. What should you be focusing on, or frankly, to take things off like my plate, right, or the rest of the team's plate, especially early on. Even from the capital side too, it's like there's a bit of an easy button by working with you guys, and I mean that in 100% in a good way, where I didn't have to stress about running full processes and things like that. So that's been a big part of it. And then of course, and wanting to see you succeed has been awesome, right? It's like people that know us, that know Bridget, that know Steph, that know a bunch of people in our team that says, we like you, you're good people, and we want to. We see what you're doing. We think it is changing the equation of how we access and hire frontline workforce in our communities, and not only see that intellectually, but emotionally want to be along for the journey, right? So if you look at, a lot of we didn't plan it to be this way, but if you look at our marketing, there are people in our industry that just give us one of your T-shirts, let us put it on. And so we can just help promote you, just because they want to see us succeed. And that's one of those things where you're just it's been overwhelming to see people just rooting for you and wanting to actively help you. So I will say, our goal by the end of this year is to be in all 50 states. A couple of legislatures we're fighting here and there, but generally speaking, we will be in all states we're able to be in. And we'll also be exploring Canada, Western Europe as well. We want to be looking at broadening our scope of services outside of kind of the core food groups into kind of like therapy services and things like that. Because we've been asked to get in those labor markets as well. So that's, and then of course with that is the idea of we want to be brand dominant. We want to get out of the world of trying to sell feature functions and just selling, hey, like we always say, join the revolution, right? And you don't even need to know exactly what that means, but we want people to know, like, these guys are wacky and they're a little different, and they're trying to disrupt how we've always done things. And so we want to be along for the journey, kind of going back to what we were talking about earlier. So that's kind of our 1 year horizon, really getting our processes scalable, really getting brand dominance. And then 4 years from now, the idea is we are in obviously in all the states, and we're in different countries, and we have gone pretty deep in those states. We're always continuing to grow market share, but we get, hopefully at that point, we get to the point where we are synonymous with, how do I solve my labor crisis? Like the labor crisis is not going away anytime soon. Like, it was bad before COVID, and even if we solved all of our COVID-related problems, we would still have a problem. So we'll always be around to help, right? And so the question is, my goal is, people know us. A lot of people know us personally because they know our heart, that we want to help. I want our brand to reflect that. And so people just know, we're going to call CARE, and because we know we love their platform. We know it makes it simple. There's so much transparency, and we control. If we were an operator, we were an administrator of a community, we can control our own destiny and not have to work with some inefficient middleman. One of the ones that we do a lot. So everyone loves our interview question. They always get asked a lot of the same ones, and so after they're hired, they get to commiserate with each other. The ones we always ask is, who's your favorite Mario Kart driver? There's I don't want to disclose too much on what we like and don't like, but there's some that are kind of usually, that's the last question. Usually it's already reinforcing what we already think about someone, how they answer that. But that one is a big one that everyone loves. We also, I'm a big fan. For some reason in my career, I've made a very strong correlation with people who are picky eaters to people who can't scale very well. And so, I always ask the question, like, you go into a quick lunch meeting, restaurant you've never been in before, how do you plan to order anything? And if someone says, well, I got to order the chicken salad, but I have to have the croutons removed, and blah, 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 they're very, very particular, then you realize, I don't know, this person's scalable. And because everybody I've ever hired that just didn't fit the culture or that wasn't scalable also typically had a very neurotic relationship with food. I don't know why, it's just usually the case.